IVF today?
As students, most of you will get married and want to become parents one day, but there are declining rates of fertility and it will get worse.
The total fertility rates in the Philippines.
UN says the declining fertility rates in the Philippines are due to increase in contraceptive use, STDs, excessive use of alcohol, stress, age when they get married, setting up their career, thus delaying childbirth, and environmental pollution. CDC in 2009 says these changes in overall health and lifestyle decrease the number and motility of sperms. Heavy alcohol use, smoking, drugs, age in getting married and choosing to have kids, environmental toxins like pesticide and lead, radiation treatment for cancer. So in 15 to 20 years, you may want to have babies but may be unable to have one naturally. You may consider IVF. Is it a good solution? 31 years ago, the first IVF baby, Louise Brown, was born in England in 1978. And Dr. Edwards and Dr. Steptoe were responsible for it.
In the Philippines, the total cost per cycle is around 264,000 pesos to 330,000 pesos. In the United States, the total cost per cycle is around 528,000 pesos to around 660,000 pesos. If additional assisted reproductive technologies are needed, it will cost more. For example, ICSI treatment, where a single sperm is injected directly into an egg, may be given an additional 44,000 to 66,000 pesos. The average number of cycles couples usually undergo before giving up for financial or emotional reasons is 4.
New England Journal of Medicine suggests 6 for optimal chances of getting pregnant.
Since 3 embryos are usually injected into the womb to maximize successful pregnancy, they reduce it to 1 or 2, so more chances that the mother won't miscarry. In as much as 30% of multiple pregnancies, 1 or more fetuses will be put to death.
The first procedure is superovulation. This is when fertility drugs are given to the woman to boost her egg production. The second procedure is the egg retrieval. The doctor will extract the eggs from the woman by inserting a thin needle through the vagina and into the ovary and sacs containing the eggs. The needle will pull the eggs and fluid out of each follicle one at a time. Third procedure, insemination and fertilization. Insemination takes place where the man's sperm with the best quality eggs are stored in a controlled environment and are put together. Doctor may resort to intracytoplasmic sperm injection when the chance of fertilization is low. The fourth procedure is embryo culture. When the fertilized egg divides, it becomes an embryo. Couples can check if their future baby
and uses
will
of
have
a thin,
hereditary
flexible
disorders,
tube where it is left to implant and form a pregnancy.
Only 7.5% of all the fertilized eggs will go on to become live-born children. The frozen human embryos are more likely to be used in research or abandoned. The last procedure is embryo transfer.
Grows and develops in the laboratory.
3 to 5 days after egg retrieval and fertilization. Unused embryos may be frozen and implanted or donated at a later date.
The live birth occurrences are 29.31%.
70 to 80% failure rate. Women undergoing in-cycle adjustments were emotionally stressed. 25% of women are reported to have depression after 1 to 2 unsuccessful IVF treatments. Fertility drugs injected may cause ovaries to become swollen and painful. Worst cases causes abdominal pain, vomiting, and shortness of breath. 4.3 stillbirths per 1,000 pregnancies. 2/3 of all IVF embryos die because of genetic abnormalities. 7% more congenital malformation than naturally conceived babies. Twice more risk to some types of heart defects. At least twice more risk to cleft lip or palate. over 4 times more risk to certain gastrointestinal defects. Where did I come from is no longer a simple question. Twiblings aren't really twins. They are not related to each other. To be successful, an IVF procedure needs 4 women and 2 men as donors. Most likely that the twins came from different sets of parents or donors. Your grandmother may also be your mother. It's possible that the grandmother is also the mother who carried the IVF baby for her homosexual son. According to the Philippine Constitution, Article 2, Section 12 states,
"The state recognizes the sanctity of family life and shall protect and strengthen the family as a basic autonomous social institution. It shall equally protect the life of the mother and the life of the unborn from conception."
So, what does the church say about this? Psalms chapter 139, verses 13 to 15 say, "For you created my inmost being, you knit me together in my mother's womb. I praise you because I am fearfully and wonderfully made. Your works are wonderful, I know that full well. My frame was not hidden from you when I was made in the secret place, when I was woven together in the depths of the earth." In Psalms chapter 127, verse 3, it says, "Behold, children are a heritage from the Lord, the fruit of the womb a reward."
From the moment the zygote is formed, demands the unconditional respect that is morally due to the human being in his bodily and spiritual totality. Since the embryo must be treated as a person, it must also be defended in its integrity, tended and cared for, to the extent possible, in the same way as any other human being, as far as medical assistance is concerned. Subsequent experience has shown, however, that all techniques of in vitro fertilization proceed as if the human embryo were simply a mass of cells to be used, selected, and discarded. In fact, techniques of in vitro fertilization are accepted based on the presupposition that the individual embryo is not deserving of full respect in the presence of competing desire for offspring, which must be satisfied. It is ethically unacceptable to dissociate procreation from the integrally personal context of the conjugal act. Human procreation is a personal act of a husband and wife, which is not capable of substitution. So if IVF is not the answer, what is? First, we have GIFT, or gamete interfallopian transfer. It allows eggs to perform their natural movement by moving to the uterus from the fallopian tubes. Second, we have the natural procreation technology, or NAPRO. It follows the natural cycles of the woman, where the doctor observes her body's rhythms to identify abnormalities that need to be treated. Or third, adoption. Remember, IVF is an important issue to you because one day you will want to be parents, but that may be difficult because infertility rates are increasing. IVF does not respect life because there are too many embryos killed in the process, whereas all children from the tiniest embryos are human persons. The Philippine Constitution says it, the Bible says it, church teachings say it. There are morally permissible alternatives to IVF like GIFT, NAPRO, and adoption.